Good afternoon, everyone. On behalf of WellSpan Health, welcome. We appreciate your engagement in this very important conversation on WellSpan's insights of the novel COVID-19 pandemic and preparing your business and team for re-entry as safe as possible. I'm Kerry Willits, Senior Vice President for WellSpan Health and Senior Executive of WellSpan's Well at Work initiatives. I personally appreciate our employers from throughout the markets that we serve, Adams, Franklin, Lancaster, Lebanon, and York counties, for joining us this afternoon. Before I begin introducing the agenda for our conversation today and the panelists, I would be remiss if I didn't acknowledge the unwavering perseverance of our frontline healthcare heroes. We are grateful for their selfless bravery, dedication, and compassion as they fight COVID-19 for you, for me, and for all. So on behalf of WellSpan, I would also like to thank our donors for their support, for supplies, money, food, and talents to help ease our staff and systems burden during these taxing times. And to you, our employer partners, we do not take your trust in us lightly as you are addressing unforeseen business complexities brought on by this pandemic. The purpose of today's call is to share consideration to protect the health and safety of your staff. We recognize that as businesses, we are all in different places. Some employers on the call have remained operational, and we are grateful for their necessary life-sustaining contributions. Other organizations on the call are in the process of reopening and returning staff to work. We understand the stress and hardships that temporary business closure has created. So wherever you are right now, we hope you find today's content relevant. As employers and residents, we turn to the Pennsylvania Department of Health and Center for Disease Control and Prevention as the source of truth for guidance and mandates to ensure the safety of our families, friends, and community. Like you, WellSpan looks to these organizations as the subject matter experts and are fortunate as a large integrated delivery system of healthcare, we can then our internal subject matter experts to lead our work to align our policies and procedures with this guidance. And for this reason, we realize that WellSpan is in a unique position to help others. So today I'm very proud to introduce some of our internal subject matter experts to share some information. First, David Hoffman. Dr. David Hoffman is the Vice President and Medical Director of WellSpan's Western Region. Dr. Jean McElwee is the Medical Director of WellSpan's Occupational Health Services. Mr. Shane Walker is the Senior Director of Infection Control. And finally, Dr. Mike Diller is a psychologist and the director of WellSpan's Employee Assistance Program. After their remarks, we will also have time to address your questions at the end of the call. In the spirit of gratitude and sharing, I'm very happy to turn over the mic now to Dr. Hoffman for WellSpan's insights and best practices.
Hello, how are you guys doing today? I want to thank you guys for this time to be able to share some of our thoughts around the COVID epidemic and pandemic. So I work really closely with the practices in Franklin, Cumberland, and Adams County, and I've seen how this pandemic has really changed the way we do business. I can only imagine how that's affected your businesses. As I've talked to my friends and neighbors who have local businesses, I've heard a lot about questions and conflicting data. How do they keep their employers safe? How do they get back to work? We have some excellent CDC, the state and local officials. However, a lot of business leaders, I think, are struggling to translate that into an actual plan and to stay in compliance. So today, our goal is to try to give you guys some insight, answer some questions, and help you through this process. So I want to initially start off and just talk about what our current state is. And so around prevalence, WellSpan's done almost 16,000 tests. And these tests essentially have been on patients that came in with symptoms, cough, fever, cold symptoms. And what we're seeing is about 10% of those tests have been positive. And so when we think about it appears that the curve is flattening, so that's great news. Social distancing is working. We're happy about that. When we look at our hospitals across all of our system, I think we have 8 hospitals. Currently, we have 50 patients in our hospitals and another 15 patients that are waiting testing to get their results back. So what I would like to share with you, one thing that's really excellent is that I think we're giving amazing care to our patients. So currently, if we look across all of our hospitals, 60% of the patients that have been put on a ventilator or been intubated have been discharged home and are surviving. And so when you think about that, in New York early on, only 12% were getting off the ventilator. And so we have learned from talking to other systems about what is working and what is not working, but I think we're providing excellent care. When we look at the demographic data, we see 2 large groups. One, we see a lot of nursing home patients, and unfortunately, nursing homes are not set up the best way to prevent these kind of spreads and have limited expertise in PPE, and we're working with them. In addition, we're seeing some demographic data around Latino and African American populations where commonly transmission happens to the family unit and they have issues around social distancing because a lot of times there's a number of people in the homes. We are working around educating these different populations at risk, as well as the rest of the national groups are doing that as well. So I think the good news is that our region has not been hit as hard as Philadelphia or New York or Montgomery County. However, based upon our current forecasting model, and we've been working with the University of Pennsylvania to really try to predict this, we do see a possible bump in cases in mid-June. And also, there's a good chance that this is going to come back in flu season again. And so we need to recognize that we have active community spread, and so we should not let our guards down. I think that's going to be really important. That being said, the importance of all these mitigation strategies are going to probably remain true until we have a proven FDA-approved vaccine. And that could take anywhere from 8 to 12 to 15 months. And so one of the questions we've been receiving a lot of talk and concern about was, what type of tests can we do on site? How do we screen our employees? And so I wanted to go over a couple things. Currently, we are doing an RNA COVID test at York Hospital. This is a nasal pharyngeal swab and gets turned around pretty quickly, but it's only being done at York Hospital. And so all of our hospitals are transporting their swabs to get those. And that takes about 8 to 12 hours. This is a fairly accurate test. We feel like 80–90% accuracy when it's done correctly. Another type of test that you're hearing a lot about are these antibody tests, which show if somebody's had previous exposure or immunity. And we know that 25% of patients don't have any symptoms. And so we know that there are patients out there that probably had it and we don't know about that. And that would be helpful in getting people back to work. Unfortunately, at this time, we have found those to be fairly inaccurate. They don't necessarily screen specifically for the COVID-19 infection, but a lot of them are screening for just the coronavirus, which is a cold virus. And so right now, we're not thinking that they're really ready for prime time. The last thing we want to talk about is screening at your areas of entry and where people are clocking in. And we strongly recommend you should be screening your employees before they come in, making sure that they don't have any. We would definitely recommend using something like a digital forehead thermometer. We feel that's safe and easy to check for fever. Those are folks that should be screened. And so I think the best preemptive measures we can really reinforce is social distancing with your teams. You need to think about how do you redesign your workspaces to avoid crowding, not having all of your employees go to lunch at the same time, staggering shifts, wearing masks. Later on in the panel, Our infectious disease guru, Shane Walker, will share some of the best practices from infection control standpoint. In close, I want to stress how important it is that if you have an employee who you might think has the infection, to have them call their primary care doc, or we have a 1-800 number that you can call, a coronavirus information hotline. That's at 855-851-3641. And that will ensure that your employees get directed to get the right care at the right place and the right time. I also want to strongly let you guys know that we have rigorous safety measures in our hospitals. And so it's a safe place for care for emergency conditions. Don't delay care for emergency conditions. Call 911 or go to your nearest emergency department immediately if you have any life-threatening conditions. Now I will invite Dr. Eugene McElwee to share some information regarding the WellSpan Occupational Health Services.
Hi, good afternoon. My name is Gene McElwee, and I'm the Medical Director of WellSpan Occupational Health. And now as Pennsylvania begins its phased reopening, a lot of our client companies are going to start to resume operations. So it'll be important as these companies welcome back their employees that they continue to heed the guidance by the Department of Health and the CDC. As employees return to the workforce, instilling confidence in them that it's safe to be on the job can be accomplished through communications and actions. So inform your staff about the safety measures that you're going to be taking. Make sure they understand what their expectations are. Wear their mask, clean their hands, maintain social distancing, and reinforce that. Most importantly, you're going to need to stress the importance of staying home at work. Operationally, you'll want to establish guidelines for some of your on-site meeting participation to ensure that you have social distancing and that can be maintained based on the Department of Health guidelines. The size of your conference rooms, your work areas may dictate the appropriate group of maximum people that should be there. Be visible, post signage in high traffic areas, and reinforce the messages. WellSpan does have a Fight COVID-19 poster. It's available in both English and Spanish. You can submit requests for that at wellatwork@wellspan.org. WellSpan Occupational Health continues to provide our core services, such as our pre-employment physicals, our DOT CDL driver exams, work comp injury and illness care, as well as our DOT and non-DOT drug testing programs. Additionally, we're able to provide employers with training to complete pre-shift temperature screening and to provide additional educational materials for your workforce. Now, as the CDC and Department of Health have suggested, those employees who have tested positive for COVID or have been in contact with someone who is positive for COVID should self-quarantine and follow return to work algorithms that are provided on the Pennsylvania Department of Health website. Those employees who are considered close contacts and exposed to a positive COVID employee will need to self-quarantine for 14 days. The COVID positive employee will not be able to return to work for at least 7 days, be fever-free for 3 days without the use of medications like acetaminophen or ibuprofen, and have improvement of symptoms. Now, what's defined as a close contact? That's someone who has been within 6 feet for more than 10 minutes for 48 hours prior to knowing that the positive COVID employee had informed the employer. Now, there are some companies who are considered essential or critical infrastructure, and they can initiate pre-shift temperature screening as part of the return to work process without quarantine. Additionally, employers should refrain from requiring returning employees to obtain work excuses from their medical providers. These are not a requirement, and they're not recommended right now by the Department of Labor or OSHA. And as Dr. Hoffman recently noted, there is no CDC guidance on return to work testing. The reality is that one COVID positive staff member can lead to multiple other exposed employees. The same precautions must be taken with all. Furthermore, facilities where these employees work must undergo thorough sanitization. For guidance regarding the disinfection process and other requirements for the employer, please refer to the Secretary's April 6, 2020 order directing building safety measures. Another resource that's just opened is on the cdc.gov site, and they have a site that specifically addresses the reopening guidance for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. This site has a lot of great industry-specific guidance. There is no doubt that a COVID-positive staff member can cause significant service disruption in an organization. And to no surprise, what we're hearing is that there are reports of employees who are refraining from self-reporting due to fear of losing their jobs. So as leaders, it will be important for you to provide staff with the reassurance that they won't lose their job and that they are supported in doing the right thing. If they don't, they threaten not only the livelihood of the organization, but also those who work around them. Sometimes challenge does give rise to opportunity. COVID-19 stay-at-home orders have forced innovation in all sectors. The healthcare industry has been transformed and now offers new, convenient ways to treat patients with less contact. WellSpan Health has reimagined healthcare and has met the challenge. The proof is in the statistics. During all of 2019, there were 1,900 video visits that were completed. During just the month of April 2020, video visits averaged 1,900 per week. So roughly 50% of all the outpatient visits that are being completed now through WellSpan are done remotely, either through video or telephone. It's only natural then that we've extended the safety and convenience of telehealth technology to care for the employers and their employees. Visits are now being facilitated via Zoom, and WellSpan has a special agreement with Zoom, which ensures HIPAA compliance and specific security measures. So we're pleased to share that Zoom telehealth visits can be implemented in lieu of face-to-face visits for work comp. So work comp follow-up visits can occur at the employee's work site with one of the WellSpan occupational health providers by using secure technology located at the work site. Alternatively, these work comp follow-up visits can be completed with the patient using his or her own device, whether it be a desktop or some form of mobile device. So telehealth visits will become a permanent service offering at Occupational Health. And eventually our plan is to make sure that we can include initial work comp visits. So more to come, and we'll certainly keep you apprised of when those developments occur. So we realize there's much to absorb, understand, and implement as a result of COVID, and especially now being so much part of our daily lives and workplaces. Remember, we're here to support you in occupational health, so please send your inquiries or requests, and that can be sent to wellatwork@wellspan.org. So now I'll turn it over to Shane Walker, and he can tell you a little bit about some of WellSpan's efforts in infectious disease containment to protect the health and safety of our valued patients and our healthcare heroes.
Thank you, Dr. McElwee. My name is Shane Walker. I'm the Senior Director for Infection Prevention Control. Previously, no one knew who I was, and all of a sudden I became very popular. So I want to thank you for giving me an opportunity to speak with you today. Want to talk a little bit about some things that you can potentially put in place in your workplace to help you through this time as you get things started back up. And certainly won't be able to touch on everything, so we'll be available for the question and answer period after this. So as all this, we got wind of this in January about this new novel strain. Initially, the reports were it was not person-to-person communicable, and really weren't sure what to expect with this. And now we find ourselves really in an unprecedented time. And the last time we've seen anything even close to this was the 1918 flu, which I don't think many of us would even begin to try and remember. So this has really been a new time for us trying to understand. And I think one of the challenges have been, quite frankly, is that because this is new, the information is ever changing. And I know that's been a source of frustration for a lot of people, but we're trying learn as we go. So things are being updated and things are being changed. So as we're all aware, Department of Health has issued the stay at home and limited to essential. And that's really been imperative to flatten this curve. And as we look to reopen across the state, I think it's really, really important to understand that it does not mean the threat is gone. So the fact that the curve stayed flat is more to do that we did a really good job in kind of hiding from it. It's not that it went away. So it's going to be really important to instill certain safeguards as we begin to open things up. So we're going to talk a little bit about best practices and some ideas that you may have. Please understand, as WellSpan Health, we are not Department of Health. As Kerry alluded to, we've been very fortunate to work with some really, really great people at the state and at the CDC. So I believe we have some unique insight that we can offer, but we still reference you back to the Pennsylvania Department of Health and to the CDC for your best practices. We do want to reach out, though, as WellSpan Health as a trusted member within the community, because as you open these items and businesses back up, we want to see you succeed, and we want to put you in a great spot because we live here too, and we're part of this community. So we certainly want to help in any way that we can. So hopefully going to give you some thoughts here and just a little bit of a brief understanding. So the biggest thing is kind of infection prevention 101 is breaking the chain of infection. And that's really what we're trying to do, and what needs to be part of your business plans is how do you break the chain? So breaking the chain can happen a few different ways. The biggest way, though, is understanding how is this transmitted. And it's transmitted primarily between droplet and contact, which means when I cough, the droplets from my cough, if I'm infected and they come in contact with your mucous membranes, you can in essence get it. The other way, though, is contact. So if I cough on something or I cough into my hand and then I open a door, you grab the door and you rub any of your mucous membranes, that's another means of transmission. So how do we break those chains? I mean, first of all is respiratory etiquette, which means cover your cough, cover your sneeze, make sure you wash your hands well, and we recommend that if you can't use soap and water, you use an alcohol-based cleaner with at least 60% isopropyl alcohol. These are not new concepts. These are the same basic infection prevention techniques that will really guide you through flu season as well as dealing with the COVID-19. What has been unique with us, obviously, is now bringing masks into place. So the mask is really important to understand. That mask does not protect me from getting COVID when I go to my grocery store. What that mask does is if I'm ill or if I'm shedding that virus, it stops that chain of infection from stopping my droplet from getting out. So that's what the purpose of the mask. I'm wearing the mask to protect others around me, not to protect myself. Some other things that have been coming into place is glove use. And I will tell you, glove use is a very tricky subject because people make the assumption that when I wear gloves, I'm protecting. Gloves harbor bacteria just like your hands do. So wearing gloves over a period of time and touching dirty things and then touching your face or other things is just like not washing your hands. So if it's a point where you think I would wash my hands before I did this, then I should change my gloves and wash my hands before I do this. So depending on the business, it may be very relevant for an employee to wear gloves, handling money. But if all they're going to do is wear the same gloves when they're handling money and still do other activities, it doesn't really stop that spread. It's just a way of potentially making it a little bit easier when it's time to wash their hands. Disinfecting surfaces are very important. Really, just about any of these disinfectants work. So COVID-19 is what we call an envelope virus, which simply means it's actually pretty easy to kill on a surface. So any of the disinfectants that are typically marketed are going to work just fine. The one thing we always reference people to is there's always what's called a contact time or a wet time or a dwell time, and it's how long that disinfectant should remain on whatever surface it is in order to really get that disinfection. So you wipe that down. We don't want you to then take a paper towel, wipe it off because it's not really allowing it to work. Disinfectants typically work better on non-porous surfaces. So those are some things to keep in track. Some other things that were brought up was about employee screening. We certainly encourage you to screen your employees. And it's really getting in a different mindset than our typical American-driven thoughts have been. If I'm sick, I'm going to suck it up and I'm going to go to work. And for this particular instance, it's a poor strategy, because when you have people sick, no matter how much we try and social distance and no matter how much we try and mask, we still don't want people that are ill coming into the workplace. And it's really by protecting ourselves, we're protecting others. So I'm going to kind of summarize here and just say, Department of Health, again, has some great references for you. So does the CDC. WellSpan has put together some resources for you as well. You can find that on our website, which is wellspan.org/coronavirus/resources for employers. And I'm sure during the chat, we can get that information out again if you get it, but wellspan.org coronavirus/resources for employees. So I want to thank you again. We'll be around for the question period. I'm going to turn it over to Mike Diller now. We'll talk about transitions, our thoughts, a process we can do as leaders to help ease stress and anxiety for employees as we turn everything back to work. Thank you.
Great. Thank you, Shane. Appreciate that update. Very thorough. Thank you. Hi, everyone. My name is Mike Diller. I'm a psychologist and the director of WellSpan Employee Assistance Program. Just want you to know, investing in the emotional well-being of your staff members, fellow team members, is one of the most rewarding, important things you can do for them and for you as a leader. The COVID-19 pandemic continues to unfold and change in ways that create uncertainty, and without a historical reference or a definitive endpoint, heightened stress is sure to follow. Prior natural disasters like 9/11 and Hurricane Katrina had a definite endpoint and then a start of a recovery. This is different. We are at a point right now, as you've heard the other experts today speak on this, where we need to maintain all of the social distancing and other preventative safety measures and find our way back to begin resuming some of those daily routines we've longed for, such as going back to work and reopening other types of business and commerce. There have been many losses since the start of this crisis, and that's important to remember to get a context of understanding. All of us have experienced that. Doesn't matter who you are. And so some examples: a loss of a loved one, loss of the way life was prior to the pandemic, loss of connection, losses involving financial, housing, food security, a sense of loss of control, and loss of sense of safety. This is stressful, as we've never had to deal with anything like this before. So what can we do? What can you do to help support your fellow team members and yourself through this during this time of transition and ongoing uncertainty? Here are some keys to remember. People do much better with routine, structure, and predictability. So the more that you provide that clear initial update when you bring everyone back together with as much factual and evidence-based information as possible. You've heard the CDC referenced several times today in the PA Department of Health guidelines. That's going to be key. But addressing things like, this is the current state. This is what we're doing to keep you safe, everyone safe, when coming back to work, following the compliance of the CDC and the guidelines and with the PA Department of Health. This is the schedule, this is who to contact and where to contact them in terms of the person or the department if there are any questions or concerns. That's going to be important in that initial and then ongoing follow-up communications. Speaking of communication, hugely important. So regular follow-ups and communication regarding updates. As everyone has already experienced, this is a slow-moving but rapidly changing crisis. So there are updates regularly, and we need to stay on top of that. And then we also need to communicate clearly and effectively in an easy way to our fellow team members. So regular follow-ups and communication, updates, changes in processes, and a way for team members to contribute and offer ideas and thoughts too with their leaders can be hugely helpful and important. Provide supportive resources such as information on your employee assistance program, your EAP program, a wellness program, other types of HR resources that could be helpful. For example, any information on connecting people to childcare resources. That's just another example. Stay connected. This is another one that's going to be hugely important in making sure that people stay resilient and kind of grounded through all of this. Staying connected, that can be done through huddles, but not all organizations are able to do that in terms of huddling together in one meeting on a particular time of day. So you just have to sometimes kind of be creative in how you check in and how you check and connect with your team members. And simple questions like asking, how are you doing? What do you need? What would be helpful right now to help you in making sure you're able to do everything you can in the safest way possible? Those questions, that connection is going to be hugely important. Here's another one. You don't always have to have all the answers. So that's okay. But being open about that, and then also letting people know that you're going to do everything you can to find the guidance that's being asked of you or that you're seeking, and making sure you get back to them. Your caring presence is going to be hugely important, monumentally so. Your support of others matters, and that will also be a positive difference maker through all of this uncertainty. It will absolutely be that way. So one other key takeaway, and people who know me, I often talk about this, it all starts with you. Before any of what we talked about today can happen to the most effective way possible, you got to make sure you take care of you first. Your mindset matters. The concept of the wise mind, so psychology has this concept of the wise mind. It's the blending of the emotional mind and the rational mind to be centered and focused. And when we're in our wise mind state, we make clear, concise, effective decisions. When we're stressed, that wise mind gets taxed, it gets tested, and sometimes we find ourselves not in our best places, not our best selves. So that's important to remember for a leader. It's also important to remember for the context and understanding of your employees coming back. When they're stressed, they all have individual stories they've led long before the pandemic, but also during this time. So it's important to remember to have some empathy and some listening of what might be going on with their stories. So that's important to remember there. But the bottom line is take care of yourself so that you can be there for those that you lead, to provide that guidance and reassurance that they seek. And let them know that together we will get through this. That's why we're together today.
Hello, I'm going to answer some questions. The first question I have here is, what is the proper protocol for returning employees to work if they were symptomatic or tested positive for COVID-19? Do we need to have a double negative test? And so at this time, we're not recommending that at all. Essentially, what we're looking at is from the time that symptoms began, we give the patient or your employee 7 days, and during that 7-day period, if they haven't had any fever within 72 hours and their cough is improved, they can be returned to work. And so that's 7 days from the initiation of when symptoms began, and then for the last 72 hours, no returning of fever. They need to have a significant decreasing in their cough and symptomatology.
Great, thank you, Dr. Hoffman. We'll move next to Dr. McElwee. There's a question about, what if an employee's spouse or child tests positive? Would the employee then need to be quarantined?
Yeah, that is on the Pennsylvania Department of Health website. They have a nice algorithm. They separate healthcare providers on one side, and then they have non-healthcare providers. So yes, if you do come in contact with a family member who is positive for COVID, then at that point you have to self-quarantine for 14 days. So it does go through that scenario on the website. So that might be a good one for employers to actually copy and kind of post somewhere so that they can refer to it, because I can tell you this all gets very confusing sometimes as you're doing it day after day, and then they make a change and you try to play catch up. So they have good resources for you to utilize right off of the website.
Great, thank you, Dr. McElwee. Probably a follow-up question to that is not only individuals in the home, but what about at work? So what should happen if an employee has a coworker who was asymptomatic at the time, but later tested positive for COVID-19? What should be the steps followed there?
So first they would have to determine, were they exposed to them within 48 hours of them being positive. So you have to go back 48 hours to see if you're truly a contact of that person. And again, the contact would be, are you within 6 feet for greater than 10 minutes? As and go back to 48 hours. So sometimes people may think that they were in the presence of a positive test, but based on the timing, they're not actually considered a true contact.
Excellent, thank you. Well, we have some additional questions that were asked when people registered. I do want to point out that there is a Q&A button at the bottom of your screen. Feel free to ask questions, type those out, submit those to us, and we'll answer as many questions as we possibly can. For those individuals where we can't get to all the questions, we want to answer your questions and support you. And so feel free to send us an email if we don't cover your questions today at wellatwork@wellspan.org. Again, that email address is wellatwork@wellspan.org. And again, we promise to get back to everybody with questions. Next question for Shane Walker. How do you best protect our family members when we come home from work?
Oh, the protection for them actually starts while you're at work. How well are we wiping down the surfaces? How well are you washing your hands? You know, how are you taking care of yourself during the work day? That is really the most important piece of that. Are you practicing social distancing while you're at work? Are your coworkers, are they properly masked when you're within that 6 feet of them? So really the protection starts with how are you complying with those things while you're at work. If there's actual concerns, and so healthcare is a little bit different with this because we're dealing with patients in a different setting, and there's some pieces we do recommend with laundering. But as I mentioned earlier, this is actually very easy to kill. So if there's a concern, honestly, it's getting home, washing your hands, taking off your clothes, normal washer and dryer, that takes care of those type of things, and that's really the best practice.
Great. An additional question for you, Shane. What safety measures do you recommend for daycares or schools?
So I am going to give the chicken answer and say I'm not Department of Health and I'm not the CDC. In all honesty, this is currently being developed as we look to open things back up. There's a lot of caveats to that. I would say at this particular point, though, my recommendation would be is to continue to watch what the Department of Health recommends as they allow these places open. They're going to give that type of guidance and adhering to that guidance. But right now, we do not have a standard answer that I would offer. The basics would still come into play, though. Disinfecting contact areas, making sure that people who are not sick are not there. Those are still the basics, but for specifics, we're going to have to wait and see how that gets recommended to apply.
Great, thank you. Dr. Diller, a question for you. How do we best support employees developing mental or emotional hardships? How do we best support them? And we also know that there are some employees that are really unwilling to return to work out of fear and anxiety. Can you speak to that?
Yeah, I think the first thing I would say is that one of the most important things is just being able to listen, be present, and validate concerns, because people are facing things that they've never faced before, feeling that even as leaders. You know, when I mentioned 6 feet, or if I sneeze right here on this call, what would the automatic reaction be for everyone? Prior to this pandemic, no one would have even had a reaction to that. So the stress is real, and we just need to be present with folks. And we also then need to, validate their concerns, listen to them, and also provide as much factual and evidence-based guidance as we can do. So you've heard Shane and Dr. McElwee and Dr. Hoffman talk about the CDC and the guidelines and the Pennsylvania Department of Health. All of those things are important. And then reassuring people that we're doing everything we can to make sure that you're safe. Sometimes that may not be enough, and sometimes people may need more. But if you start there and you're present and you're listening and giving them a voice to express those concerns, that's hugely important. And then there are other supports there. We want to direct people to supports that, again, I had said earlier, you don't have to have all the answers, but if you connect people to supports, it can also be very helpful. So at the end, I'll share a website as well that we've compiled very trusted resources that can help with the kind of the emotional, psychological, total whole person well-being through all of this uncertainty, and we'll direct people there, and sometimes that can be very helpful also. If you have an EAP, this would be the time that I would be promoting that. I would be sharing that information. I would be normalizing and validating that it's okay to reach out for a little support along the way. I would also say that that was long true before this time period. It will long be true well after COVID-19. So those are just some things there. Even as an EAP, we've done things with our partners and some folks that are not even our partners now, where we've set up some support for teams when they've reached out to us, where we can kind of talk things through and help ease some of the emotional and psychological kind of burden that people are carrying. So I think back to the beginning, if you're present, you have a true, genuine, empathic, caring presence, that's where it starts as leaders. And then being able to connect people to supports because you don't have to have the answer.
Great. Thank you, Dr. Diller. Dr. McElwee, a question for you. How do you best manage the communications and reduce the anxiety levels with employees when a coworker is unable to come to work due to possible COVID-19 infection?
Well, I think part of it is, again, providing the other employees with the information regarding their contact, and again, mitigating ways that they can contract it to begin with. I think that as long as they're told to self-monitor, watch for signs or symptoms, if it's a work site where they're doing daily pre-shift temperature screening, then that's certainly a good way for people to be reassured that the workforce is being screened. And then should they become sick, then make sure that those people feel comfortable enough to talk to their supervisor and say, you know, I've developed symptoms, and then that way they can be sent home. So I think it's really kind of the communication and the employee feeling open to communicate with their supervisors about what's going on.
Great, thank you. Dr. Hoffman, a question for you. How do we know when someone is no longer contagious?
Can you hear me?
Yes.
Excellent. Well, I mean, there's a lot of questions about how long people will shed virus. And I think that's a question we're all kind of grappling with. And so if we follow the recommendations that we're going to clear patients to go back to work after 7 days from the symptoms starting, and then a 72-hour period where the symptoms are improved and they haven't had a fever, there's still a possibility they may be shedding some virus. But essentially, that's why when they go back to the workplace, they wear a mask. And we use appropriate distancing, we clean our surfaces like Shane talked about. And so I think this is going to be a continued issue. We also know that there are patients that have no symptoms at all. 25% of people that get this infection may have zero symptoms. So again, with community spread, we have to assume everybody could possibly be shedding virus, and we need to make sure that we're following the appropriate guidelines as we suggested today.
Thank you. A question either to Dr. McElwee or Dr. Hoffman. Are there any contact tracing spreadsheets or templates that you can recommend to use to manage this?
I believe there is on the Department of Health, the website, they actually have a form that you can utilize that the employer can take to the potentially exposed coworkers. Actually, the positive person will trace for 48 hours prior that they may have had at the workplace or at home. So that's a way then for the employer to go back to that group of employees, of course, not naming the particular person who's positive to avoid ADA issues, but they are able to go and tell those other employees that indeed they were exposed, and then initiate the precautions and the monitoring. And again, now it depends, are you a critical infrastructure? Because if you're doing the pre-shift screening, those people can remain in the workplace. If it's not, if they're not essential, now they have to start that 14-day quarantine. So that's important to kind of keep that distinction, because it'll apply differently to depending on what type of company you are.
Very good. Dr. McElwee, another question on temperature screening. Can temperature screening be self-reported or recommended by being taken by another employee?
The Department of Health guidance is that it should not be self-reported, but that it should actually occur at the time of entrance to the work facility. It can be performed by other employees. You do not have to be a healthcare professional in order to do those screenings. So typically it could be done by HR folks, or a lot of companies have their own safety teams, so it could be performed by them. There's no need to do it more than once a day, so it's just at the entrance to the workplace.
Great, thank you. So I know there are many other questions at this point. We will get back to any of you. Again, if you would email us at wellatwork@wellspan.org, we're happy to support you with any needs that you have. At this time, we're going to turn the program back over to Dr. Mike Diller to share some additional thoughts.
Thank you, Andy. I appreciate that. And I just want, I'm going to end here with sharing a little bit with you, just as kind of something to embrace and a takeaway, kind of summarizing everything that we've talked about today. Appreciate your time in joining us. But I'm going to share something, and it's a little bit of a story, brief. It's a parable from David Kessler. Some of you may know David. His work, he's the world's foremost expert on grief and loss. And he's been doing a lot of public speaking related to grief and loss in this time of uncertainty in the current pandemic. The parable is called the parable of the long spoon. So we have a man who walks into a room, and this room is lined with a long table with beautiful linens and china and serving dishes of the most decadent and beautiful food. The smells were just fantastic and wonderful. And he's looking at this, but they all have in these individual serving dishes these long-handled spoons. And so he looks around the room and he sees a lot of people. And what he sees in these people are they're depressed, despondent, gaunt, and lifeless, and realizes that they can't eat because the spoons are too long. That was described as being hell. He moves into the other room and he enters the room, and it's much the same. The room is long table, same kind of food, decadent, and just the smells are wonderful. Long spoons are in each of the serving dishes. And he turns around, looks at the room full of people, happy, full of life. And he realizes that they're using the long spoons to feed each other. The point that David's making, and the one that I want to make sure that we wrap our kind of arms around, is that we are truly in a very difficult time. And we'll get through this by being together and supporting one another. So that's the takeaway from the parable of the long spoons. We want to thank you for your participation today. It's a privilege to be here with you, and thank you. So please know that we are in this together, and we are, WellSpan Health is here for you. Let us know how we can continue to help support you and your fellow team members. If you have any ideas or questions that are still existing, please, from today's webinar, please don't hesitate to reach out to us. Or if you would like to learn more about some of the things we've talked about or the support that we can give you, please reach out to us at www.wellspan.org/coronavirus/resources for employers. You will find links to many of the resources that were mentioned on today's webinar, and they're located right there. So we thank you, and please reach out to us if you need us. We're here for you. You take good care.